This presentation is a quick overview of some of the key modules in Interact's iResidency program. So let's remember that the key purpose of Interact's iResidency software solutions are to help you save time so that you can spend more time taking care of patients. And in order to help you save time, we can automate a lot of processes across the organization. That includes recruitment, onboarding of new residents, probation planning, and obviously that includes competency management, which is directly connected to residents' performance management. We also have what we call patient engagement plans, where you can define very specific objectives and competencies and even training linked to a particular patient that the resident is working with. We also allow you to define broader career plans, put together a training plan, and obviously track residents' time and schedules and look at health and safety and disciplinary actions. All that information will be kept in one place, will be accessed by all the people involved in the program that need to have access to this information, obviously based on specific access control rights, and will allow you to focus more on providing the services and helping the resident develop the skills that they need to develop. So let's look at what would be the outcome if you've actually used our product in all these different areas and where all this information lands in the end, and that is the employee electronic record. Now, the employee electronic record is a huge amount of information that's all in one place, which can be accessed by all the right people that need to have access to this information. So there's no more need for you to go looking for it all over the place. For example, I can track my residents' publications, speaking events, associations, medical records, supporting material, certifications, and obviously competencies, performance reviews, career plan, training records. All this information is all in one place. You no longer need to look for it. It's going to be available for you right here at the moment that you need it. All right, and it can be maintained by the secretary or by the resident, him or herself. All of that will be totally flexible. So obviously that's part of the objective, which is that we need to get you immediate access to the correct information on your residents and that information is reviewed by the appropriate people. The same resident could log in through self-service and maintain these records. But let's go and take a look now at what other functionality we have, specifically when it comes to the residency management. So we'll explain briefly that in recruitment and hiring, you can define how people will be recruited. You have a full-blown recruitment cycle that allows you to have applicants register through self-service and to create a profile. You'll be able to search for these applicants. You'll be able to interview these applicants and record assessments, and applicants will have their own self-service through which they will be able to monitor the progress of the application. Now, let's look at the residency management. Here is a general setup where I can define exactly what kind of specialties and subspecialties we have in our organization. We can define the details of the residency programs in each segment, the locations where residents may be going on rotations, the examination rooms, and the actual program document. You can also define standard questions for past medical history so that these questions can be used as part of a questionnaire that patients have to fill in or that doctors have to fill in on behalf of patients before particular tests are done. You could define, for example, if we're in radiology, you'll be able to define the radiology examination types, the CPT codes, and the ICD codes, so that everything gets more standardized and structured in terms of how things are communicated. We can interface the product to RIS systems and PACS systems using HL7 and DICOM interfaces so that these applications will provide the necessary statistics as well as the images that are required for residents to review when they take exams. The training management system allows you to define the rotations, defines the detailed competencies that people need to develop, the training courses associated with that, and it allows you to manage a whole quiz system so that consultants can create quizzes on the fly for their residents to complete through their self-service. And obviously, the system has the ability to define shifts and shift types and then assign residents to particular shifts. So let's take a look at some of these elements here. The applications themselves. We'll take a look at a new application. And here you'll notice that we'll be able to collect the applicant's name, general information, address information, but also academic credentials, internship information, transcripts can be attached, and lots of other documents can be uploaded based on the requirements of the system. Here you'll be able to add references, documents, and interview details will be collected as part of the interview process. Obviously, once these applicants have been accepted in the program, they will automatically be turned into residents, and all the information will be transferred into their resident file. Then you go and define residency plans. These residency plans are really performance plans of what exactly you expect your resident to achieve in terms of training, academic activity, and competencies that they need to develop. And obviously, there will be a resident performance appraisal based on that. These performance appraisals can be done as many times as you want during the year. Then you have your patients, which will be imported, in fact, from your external applications. You have patient visits that will be tracked. In the case of radiology, you will have exam orders that are assigned to your residents. So I'll take a look at an interpretation report here. We'll look at one that's done by Barbara. And what you'll notice here is that we have the ability to obtain diagnostic images. So these images will automatically appear and will be viewable for the resident when he's writing his report. Or alternatively, it will be viewable obviously during the time of the quiz. So quizzes can be assigned to these particular items. You'll be able to look at all the pictures as you require them, and you can resize them if necessary as much as required. Now, so this is where the report can be written in terms of comments based on the diagnostic images that have been obtained. I'll just also show you briefly the actual quizzes, how they can be created. You will first define the quiz subject area, and obviously afterwards you will do all the other items. Here you see an example of where you have the ability to define a question. You link a case image to that. You link that even to a specific patient if necessary. And then you define the answers that are possible and which one is the correct answer. So like this, easily you will be able to define your own quizzes as a consultant and then assign them to your residents for review. Now, the last part is that you can define and schedule people's shifts. So that for that purpose, we have the schedule planner, which will allow you to quickly assign people to the correct shifts. Now, remember that this is all part of a more integrated system, a much more powerful application that provides you with alerts. Alerts will be sent to you via email or via SMS on anything, whether it's a performance review that's overdue, or whether it's the fact that the resident has not completed enough academic activities yet for the month or has not dealt with enough case images yet. It could be disciplinary actions that you need to track. We have the ability to track people's time and leave. We have the ability to define very comprehensive career plans, training plans, performance plans, and so on. We can track specific assets that are assigned to residents. We can track health and safety and make sure that people are following the policies that have been defined for the residency program and that everything is done in the right manner. Obviously, as a result of all of that, you can generate reports, and all these reports can be automatically exported to Excel, Word, or PDF. And this will allow you to keep track of your information in one centralized place through web-based applications so that everybody is able to log in, whether they are in the main hospital or whether they are in another hospital as part of another rotation. This gives you a very brief idea of what the product can do for you.